Bell's palsy is a sudden weakness or paralysis that affects one side of the face. It happens when the facial nerve, which controls facial muscles, becomes inflamed or compressed. This condition can make it difficult to smile, blink, or move the facial muscles on one side of the face. The facial nerve runs through a narrow pathway in the skull. When it swells or becomes inflamed, it presses against the surrounding bone, interrupting signals between the brain and facial muscles. The exact cause isn't always known, but it's often linked to viral infections such as herpes simplex, which causes cold sores. Bell's palsy can affect anyone, but certain factors increase the risk. These include viral infections, diabetes, pregnancy, especially in the third trimester, upper respiratory illnesses like the flu or cold. Symptoms usually appear suddenly, often overnight, and may include drooping on one side of the face, inability to close one eye, drooling, loss of taste on one side of the tongue, sensitivity to sound in one ear. These signs can sometimes mimic a stroke, but Bell's palsy only affects facial muscles, not limb movement or speech comprehension. Diagnosis is mostly clinical. A doctor examines facial movement and may order imaging or blood tests to rule out other causes. Early treatment improves recovery chances. Treatment may include corticosteroids to reduce inflammation, antiviral drugs if a virus is suspected, physical therapy to keep facial muscles active. Most people begin to recover within 2 to 3 weeks and fully recover within 3 to 6 months. In rare cases, some weakness or facial asymmetry may remain, but early medical attention and facial exercises can make a big difference. Bell's palsy can be frightening, but it's usually temporary. With the right care, patience, and support, most people regain their normal facial movement and confidence.